All right, everyone, welcome to today's class, day 3 of our class. And my section for today, we'll do our relaxation and visualization breathing practice. When we start, I'm going to ask you to go in breakout rooms and share your study area and take a look at your goals again. Okay, and then I'm going to talk about the Pomodoro technique as a testing strategy.
For my portion, we're just doing, take a look at the homework, although I kind of was looking at some of it last night. So we'll see how our time is. Make sure volume, I don't know whose volume that is. And then we'll do some 10-minute quizzes. Again, I'm going to do one to where we kind of sit there and look over it together, the quick 10-minute one, so that we can learn how to rule out some of the answers. And then we'll just practice doing the regular quizzes so that you guys get some study time in today. And then that'll be it for us.
Okay. Okay. So before we get into our breakout rooms and talk about our study areas and our goals again, we're going to do our deep breathing relaxation first, and then visualization. Okay, I was going to put on some relaxation music. Can we try? We'll see if it works. If it doesn't work and it's too loud, then we won't do that. So let me stop sharing for a moment and let me pull that up. I also posted this the link to this YouTube relaxation music in our Google Classroom, so you can check it out anytime. Okay. All right. Share it. Okay. All right. So everybody get comfortable in your chair. Kind of roll your shoulders back. Move your head around. Right, front, back, just kind of loosen up a little bit and get yourself comfortable. Okay, sit up straight. Open up your chest so you can breathe as deeply as you can. Shoulders back a little bit. Close your eyes. Ding dong. Miley, can you let that person in, please? Sorry. Okay, we'll just take a moment to hear that music. Okay, just on your own, take a couple of deep cleansing breaths. Breathe deeply in and exhale out. Focus yourself in our space right now. Okay, let's start with our relaxation. So we're going to start at
Sorry, not to throw this off right away, but I actually don't even have the thing to let anybody in because of the screen share. So I don't even have the admit thing on there for any students who come in.
Really? Okay, wait. Do I? Pausing our relaxation. I was just getting into it too. Okay, wait. Let me.
They're fine.
I guess we can't. Yeah. Oh, participation. So, Miley, if you go to that bottom, you cannot see that. Minimize your screen. Minimize your screen, and then if you look up, you'll see somebody in the. Actually, that person just came in, so they're not. They just entered. So.
Okay, we're good.
Okay, let's start.
Meditation.
Let's start again. All right. Let me get this moving again. Okay, back, close your eyes. We're going to start with our relaxation. Let's just do another couple of cleansing breaths to kind of focus us in again. Okay, you're going to start at your toes and your feet and maybe your ankles. And you're going to tense it up as tight as you can. Tense, 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 tense. Take a deep breath in. Hold it. When you exhale, you're going to relax your toes and your feet and your ankles. Exhale. Moving up our body to our calves, our thighs. Tense it up as tight as you can. Tense, tense, tense. Deep breath in. Hold it. Exhale and release the tension. Moving up, let's go to our torso. Tense your torso as tight as you can. Tense your rib cage. Flex your muscles. Deep breath in. Hold it. Exhale and release the tension. Moving on to our arms, our wrists, our fingers, our hands, our fingers. Tense it up, tight, tight, tight. Make a fist. Deep breath in. Hold it. Exhale with the tension. Release that tension. Okay, moving up to our shoulders and our neck. Tense it up. Hold it. Inhale. Exhale and release the tension. Moving up to our head. Tense up your head. Squint your eyes. Squeeze your eyes tight. Deep breath in. Hold it. Release and exhale. Okay, keeping your eyes closed. Just kind of move your relaxed body. Shoulder shrugs back. Okay, we're going to move on to our visualization. In your mind right now, I want you to picture the number one obstacle that is preventing you from reaching your goals. Picture the number one obstacle that is preventing you from reaching your goal. Get a clear picture of that in your head. When we breathe in, you're going to focus totally on that. And then when we exhale, you're just going to release it and throw it in the trash. Throw it in the fire. Throw it out the door. Okay, get that picture in your head. Deep breath in. Hold it. Get a clear picture. Big exhale and release it. Okay, so now that obstacle is out of the way. It's out of the picture. I want you to visualize your successes. All of them. I want you to think of a mantra in your head that you can chant. You don't have to chant it aloud. You just chant it in your head. If it's pass the test, pass the test. If it's 100%, 100%. If it's make the time, make the time. Whatever your mantra is for, let's say for today, whatever your mantra is for today, I want you to chant that in your head right now. Keep breathing deeply as you're chanting that in your head. Visualize it, get a clear picture, clear mental picture of that goal in your head. Hold it there for a few seconds. Okay, holding that in, we're going to do 3 deep breaths and very loud exhales. Deep breath, like, and then, okay, I want you to make that noise. Okay, everybody ready? Got that clear picture in your head? You're chanting your mantra in your head. Deep breath in, go. Hold it. Big exhale. Clear that stale air out of your lungs. Okay, deep breath again. Go ahead, inhale. Hold it. Big exhale. One more time. Get that image in your head, clear as day. Deepest inhale ever. Hold it. Deepest exhale ever. Just sit here with your eyes closed. Focus on the space we're in right now. All right, open your eyes, shake it off, move around a little bit in your chair. Okay, I think we're ready to go. What do you think? Sorry for the trash truck that came. I hope you guys didn't hear. I hope it wasn't too distracting. All right, that's what happens when you're at home, right? All right, so we're going to right now we're going to take a few minutes. I'm going to put you into breakout rooms again, and as we usually do, is kind of our little warm up. And I want you to, if you took a picture of your study area and you posted it in Google Classroom, please share that or share it on your phone. Or if you didn't do it, take a picture of where you are right now, and you can share it with your partner. And if it's not exactly what you want, talk to your partner about how you would fix up that area to be your personal study area. Okay. In addition to that, I'm going to ask you to please go back to your goal setting worksheet. All right. And I don't know if I haven't looked at it. I'm sorry, but some of you might have added things, but revisit it again and talk story about it with your partner. Okay. We're always going to revisit that, right? We always revisit our goals. We always keep it in mind. We always want it at the front of our mind, right? As we're going through this class and as we're preparing for this test. Okay. Okay. So I'm going to put you into breakout rooms and just that it's another way of kind of relaxing and relaxing and getting your mind focused on what we're doing. Okay. Wait. Okay, so you'll either have you'll either have 2 or 3 people in your room. So everybody take equal time sharing. Okay. All right. Here we go. Opening the rooms. All right, everyone, welcome back. Let me share my screen so we can move on. Did you guys get some inspiration from each other? I hope so. Make it a slideshow. Okay, so we're going to be talking about the Pomodoro technique, and this is just a test take. Actually, not only for tests, it's for it's just a time management strategy to get things done. Okay, and just a little bit of background, but I think that they'll give you some background in the short video that we're going to watch. But a Pomodoro is this tomato that you see on our slide here. And it's called the Pomodoro technique because the originator used a tomato timer. I don't know if you've ever seen those kitchen timers that looks like a tomato to to do this strategy. So I'm going to play the short video for you to get a background on what the Pomodoro technique is. Okay.
The Pomodoro technique is one of my favorite techniques to fight.
Okay, wait, let me turn up the volume and start it again. Oh yeah, I forgot. In addition to this, if everybody can open their Google Classroom. Wait, let me show you that first. Sorry, I forgot about that. That's the most important part. In our Google Classroom in day 3, where we are today, you will see this Pomodoro technique video outline. If you could open that, please, and access the worksheet. Okay, and the worksheet looks like this, and it's just kind of to keep you focused and on track. The guy does speak a little bit quickly when he's going through the steps in the Pomodoro technique and he's talking about it, but I just want you to try as best as you can to get to fill in this outline with the information about this technique. Okay, so you'll hear like when it was invented, who it was created by, what is it named after, right? So as you're listening to the guy talking, please try to complete this outline. This outline is just the important information or the key information that's presented in the video. Okay, so if you could do that, open that and try and complete as much as you can with it. Okay. Okay, back to our video. Okay, let me get rid of this. Okay, here we go.
The Pomodoro technique is one of my favorite techniques to fight procrastination and maintain focus and productivity throughout the day. Stay tuned for tips on how to incorporate this into your study routine. What's going on, guys? This is Jay from medschoolinsiders.com. First, I want to talk to you a little bit about the history of the Pomodoro technique. So it was invented back in the early 1990s by Francesco Cirillo. I don't know if I'm pronouncing that right. He named it the Pomodoro technique after the tomato-shaped timer that he used to actually track his work as a university student. Since then, this technique has gained much popularity in various productivity and self-improvement circles. So the theory behind it is that any large task or any series of tasks can be broken down into short timed intervals called pomodoros. Each is separated by a short break. This takes advantage of the fact that our brains have limited attention spans. So as to how to use it, the only item you really need is a timer. You can go old-fashioned or use your phone or computer with an app. My favorite app is called 3030 on the iPhone. It's my favorite because of its clean interface and customizability, thus making it easy to do the traditional Pomodoro or customize it to your liking. More on that in a little bit. So first, choose a task or series of tasks that you need to accomplish. Next, set the timer to 25 minutes. Continue to work on the task until the timer goes off. Avoid constantly checking the timer. Once the timer goes off, take a short break for 5 minutes. Get up during this time. Do not take the break at the same spot that you were working. I personally like getting up, holding a third world squat, stretching, moving around. Now is also the time to use the bathroom and grab a refill for your water. After 4 Pomodoro cycles, take a longer break of 20 minutes. Rinse and repeat. Distractions. During your Pomodoro cycles, do your best to limit distractions. The whole point is 25 minutes of intense focus. Don't be checking Facebook or Reddit or the Med School Insiders website on and off. Focus on the task at hand. So I personally put my phone on either airplane mode or do not disturb mode, but be careful because do not disturb mode can actually affect the notifications on your timer app if you are using your smartphone app. If someone else comes knocking for help, use the inform, negotiate, callback strategy, which was suggested by Francesco Cirillo himself. So inform the distracting party that you're in the middle of something, negotiate a time when you can get back to them, and call back when your Pomodoro is complete and you're ready to address their need. When to use it. I only found out about the technique in medical school, and if you've checked my first video ever, link above right here, then you'll know that it is one of the key strategies that I wish I started using as an undergrad in college. So I often use this when I can't get myself motivated to study for a subject that is either particularly dull or boring. So anyways, I get my Pomodoro app started and I tell myself I just need to do one cycle of 25 minutes. By making this commitment small to just do a small amount of work, it's easier to get started. And once I finish that cycle, it always feels less daunting as I've built momentum. At this time, it's usually not a problem to keep moving forward with my work. I've also found it useful for reading textbook chapters, going through my Anki deck, and getting started on background reading for research projects. Remember though that Pomodoro is ultimately a productivity system to serve you. Therefore, don't feel obligated to always take a break if you're in the groove. For longer days where you'll be studying for most of the day, such as the day before a final exam, I recommend you do take breaks as this sustains your stamina and prevents burnout. Sometimes though, it's best to just keep chugging along once you've built momentum. I often stop the Pomodoro app and continue my work without breaks when I'm either reviewing lectures or doing research, data analysis, and writing. So with reviewing lectures, I generally review one lecture, take a brief break after finishing the lecture, and then move on to the next. These breaks feel more natural to me than taking timed breaks, but as always, figure out what works best for you. So going on to research. While Pomodoro has been conducive to background research reading for myself, I find that the writing and the analysis part of research requires prolonged periods of concentration, and therefore I prefer to not take the break after 25 minutes. At this time, I either modify my Pomodoro or I just go for long stretches without taking a break. So then going on to modifications, again, because Pomodoro is a template to help you increase your productivity, you may want to actually alter the timing scheme. So for some tasks, it may be best to alter the timing intervals from a 25 5-minute allocation, which is the default, to something like a 50-10. I've used the 50-10 minute intervals with good results. Figure out what works best for you. You can change it up however you please. Again, the 30-30 app allows for flexibility in this regard and has a great interface. Alright guys, that is it for this video. If you found any of these tips helpful, please press the like button below. New videos every week. Hit
All right. So let me get out of this. Okay, so let's take a look at the our outline together and kind of see what we came up with. If you got stuff, like I said, he spoke kind of quickly, but we'll just, go through it and get as much as we can here. And you can always look at the video. The video is attached. It's actually posted in our Google Classroom. Okay, so when was this technique invented? Anybody?
Early 1990s.
Yeah, early 1990s. So it's not that old, right? I mean, well, I guess it is. Who was it created by? Did anybody get that? He said it kind of quickly. He said it a couple of times, but he said it was by Francisco Cirillo, right? Francisco Cirillo. And what is it named after? Hello? Is anybody out there?
The tomato timer.
Yeah, the tomato timer. Good. It looks, and this is a Pomodoro tomato, right? Okay, so it's the task can be broken down into short time intervals. So it's 4 heavy duty tasks, like what you guys are doing, right? Preparing for your test. All right. So it's these intervals are. He said you can pretty much do it however you want to, but originally it was 25 minutes of doing the task and then 5-minute intervals, right? I mean 5-minute breaks, right? So this he asked what you need is a timer. So in our Google Classroom, I have posted or put in the Pomodoro timer, and it looks like this. Okay, and you can set it to whatever you need to, right? This is it doesn't look like a tomato, but it's the tomato timer. So it's already set at 25, but I think you can fix it, right? So then you can fix it as a short break or a long break, whatever you want. You can change it. Okay, and then you start it, and then there's alarm that goes off when you need to take a break or when your thing is finished or your time is up. Okay. All right. Wait, where am I? Okay. So that's the timer. He suggested using, if you have an iPhone, I guess it was, what is it called? I don't have an iPhone, so I don't know. The 30-30 timer on iPhone. That's what he suggested. Okay, choose your task or series of tasks. So our tasks that we choose are your quizzes, right? Creating your quizzes and doing your quizzes. So you can take it, because you do, Miley asks you always to do like 10 minutes quizzes, but you can, as you get better and you get more into it, you can make it longer, right? You can set it for 25-minute quizzes. Okay. Choose your task, avoid checking the timer, and take a blank minute break. So 5-minute break, right? In between. And he suggests that you stand up from where you are, walk around, grab some water, grab a snack, go to the restroom, right? But get out of that place you're sitting. Okay. Like stand up and move around. Maybe you could do some deep breathing or whatever you need to do. Okay. So you can take a longer break, he says, after 4 cycles, right? So after 25 minute, 25 minute, 25, 25 minute, then you take a longer break. Okay, maybe eat lunch or whatever. Okay, focus for distractions, focus on the task at hand. He talks about inform, negotiate, and call back. Right. So if somebody's bothering you or distracting you, you inform them that you're in the middle of something, negotiate a time that you can meet later, or what how you can contact them later, and then call them back or tell them that you're going to call them back. Okay. So when do you use it? Like when you have a big task to do, right? And don't need to take breaks. You don't need to, but he says that you should, so you avoid burnout, right? You don't want to be working so hard that you burn out, and then your mind starts playing tricks on you, right? Like you start getting kind of confused, things start going into each other. So please take breaks in between. Okay, so Pomodoro is a template, make it work for you. You can create the cycles of working and breaking. And it's something, it's just a strategy to help you. And I would like you to really make an effort to try and try it out and use it. And another point that the guy makes when he's talking is that he said, when you like, sometimes you're unmotivated to do something, right? You'd rather be doing something else and you're kind of unmotivated, but thinking about doing this task in smaller chunks will kind of motivate you. I can do 25 minutes of studying. That's not so bad. Or I can do 10 minutes of studying. Or maybe you do 10 minutes, break 10 minutes. Okay. And then hopefully that will kind of motivate you to keep going. Okay, so just going over
The Pomodoro technique is
sorry
one of
about
my
that. So just kind of going over the 6 steps, right? So choose a task. Number 1, choose a task you want to get done. Something big, small, and that's not only for this test, right? It can be for homework or preparing for, I think it could be like physical activity too, like you're getting ready to do that. What is it called, Miley? The thing that they're doing now?
Which,
The exercise thing that everybody has to pass and do.
oh, the PAT.
The PAT,
Yeah.
the PAT, right? So as you're preparing for that, do 25 minutes of it and take a break, or do 10 minutes of it and take a break. So whatever, something big, something small, something you've been putting off, it doesn't matter. Okay, it's just getting your full attention on doing that task. Full attention, okay? Set it for 25 minutes, your Pomodoro or your Pomodoro timer. Okay, make a small promise, oath or promise to yourself that you'll spend 25 minutes on this task. You won't interrupt yourself. You won't you won't get distracted. Don't look at your phone. Don't look at Facebook. Don't check your Instagram or whatever, right? You're just going to turn your phone on airplane mode or do not disturb or whatever, so you're not distracted by that. Okay, you can do it. It's only 25 minutes. Okay, 3, work on the task until the Pomodoro rings or the timer goes off, right? So immersing yourself for 25 minutes. Then it says if you suddenly realize you have something else to do, just write it down on a piece of paper and you can come back to it after. Okay, number 4, when the Pomodoro rings, put a check mark on a paper. Congratulations, you spent an entire interruption-less Pomodoro on a task, right? So as soon as ding, you put a check mark and you're like, okay, I did that. I spent that 25 minutes. Take a short break, breathe, meditate, grab a cup of coffee, short walk, something relaxing, not work related. Look at your Facebook at that time, stand up from your chair, whatever. And then 6, for every 4 Pomodoros, take a longer break, right? So you can take 20 minutes or 30 minutes. Like I said, you can have lunch or breakfast or whatever, or dinner, eat, walk around, take a walk around the block, but it's a little bit longer time. Whatever works for you. That's how you use the Pomodoro. Okay, so I would like you to really try and do this as you do your practice quizzes for homework. You know, use the strategies that we've been talking about, right? Have your place, right? Have your little study area. Do some breathing and visualization, deep breathing, relax yourself, get ready, right? Set up your timer, set up your Pomodoro timer, set up your quiz, and then just focus in. And you know, I promise it's proven that it will work, right, Miley? So try your best to use all of our techniques. Okay, if there are no more questions or anything, I think we are ready to move on. Miley?
Yep.
You're up.
Do you want me to share my screen instead, Kalihua?
Okay, up to you. Let me stop sharing then.
You guys all still alive?
I know Miss K was blobbing for a little bit.
No, it's not that. It's that everybody was so relaxed over here that they all looked like they were passed out. Okay.
All right, go ahead. You're up.
Oh, hold on. See, Darian, I'm just like you. All right. So I just want to touch on some of the stuff that you guys are going to be covering in each section before we start going over our questions, to kind of give you guys a better idea of what you guys are going to be studying. Are you okay? Do you need tissue? You all right? You need tissue? Okay. For your airway section, okay, you guys got to know anatomy, your airway management techniques, and your oxygen equipment. So for airway anatomy, guys, go back to your Pearson, right? Use your Pearson stuff. Get like at least have a diagram. I always suggest like just have a diagram of the airway anatomy, put it up somewhere so that you guys can look at it, because that is one of the things that they ask a lot of questions about. So know, you know, your upper versus lower, what's in each one, how many regions of the lung you have on each side. Just put something up. At least you have something to look at, and look at it as often as possible. So airway management techniques, that's kind of what we talked about yesterday, with knowing whether or not you're using a nasal cannula, a BVM, a non-rebreather, kind of based on your patient's signs and symptoms, right? And it's rate and quality of breathing that are going to change the type of airway equipment that you guys are going to be using. Okay. For your O2 and oxygen equipment, just make sure you guys know what each one is and what percentage of O2 each one delivers, because that's important. Okay. Let's just double check a few things. Which one gives us the highest, which airway adjunct gives us the highest percentage of O2? Okay, so BVM, CPAP, anything that's positive pressure, that's the key word, right? Anything that's positive pressure ventilation, we're doing that with, it's 100% O2, right? Okay, good. So that's your airway section. Medical emergencies. You guys see how much is under this category, right? Which is why it is such a big category. You got your pharmacology. You know, how many drugs can you guys give? Okay, so let's name them. What we got? Oxygen. Those of you guys who are not here with me, try unmute yourselves so we can all kind of talk about it. So oxygen, what else? Okay. Nitro, oral glucose, activated charcoal, epi, MDI. What are we missing?
Wait, like we can give, not like.
Yes, just you as an EMT, everything that falls under your pharmacology. So aspirin, yes, that's our, did we not say aspirin? We did, right? No, maybe we didn't. Okay, and what's our dose of aspirin? This is just our quick jog this morning. 81 milligrams times 2. So 162 milligrams of aspirin. Okay, good. Yep, I think so. I think that was all of them. Yeah, okay. Okay, good. Yeah, it's okay. That's good. They would just want a quick overview. I lost count. Okay. So respiratory, cardiac, diabetes, allergies, anaphylaxis, right? Poisoning and overdose, environmental. And for those of you who weren't in my class, I was telling my students, environmental was the one thing in my NREMTs in both of them, EMT and paramedic level, that I thought I was going to fail my NREMT over, because I just didn't realize I just didn't even think about the environmental stuff. Like I had the snake bite questions on there, and I'm like, oh my God, I'm going to fail my NREMT because of a snake bite question. So just touch on that stuff too. Okay. Don't leave that kind of stuff out, even though we don't deal with those things here. This is a national test. So they do ask you those questions. A lot of, as far as environmental, the hypo and hyperthermic patients, they do ask questions on that stuff. So know your ranges. Okay. Behavioral, psychological, you guys saw how many psych emergencies we have. There's a lot. Okay. So just kind of review that stuff as well. OB, again, that's a neglected subject for a lot of people. There's a lot of things that can go wrong. I would really suggest going over the complications that you can have. Okay, what like breech birth and all that kind of stuff, because they do ask questions about that. And then again, for those of you who are in John and Jack's class in the Google Classroom, I put our notes that I give these guys, the extra notes that cover those particular chapters that I feel like everybody doesn't get enough information on. So I wrote out some notes, and it's all in there in Google Classroom for those chapters to kind of help give you guys a better outline of what to go over. Okay. Okay, trauma. So bleeding and shock, make sure a lot of the scenarios I've noticed, they're going to give you shocky symptoms, right? And one of the key things to look for is those skin signs. So what are skin signs for a shocky patient? Pale, cool, diaphoretic, right? And then what happens to the blood pressure when our patients are in shock?
Goes high, then drop.
Right. So it's gonna, if they're in shock, it's gonna be low, right? You're gonna see those low blood pressures. So look for the low blood pressures, those pale, cool, diaphoretic. If you see those keywords in there, they are trying to communicate that that patient is in shock, and you guys need to treat for shock in accordance to your skill sheet. Okay. Soft tissue and musculoskeletal injuries, that chapter where we talk about abrasion versus laceration. Go and look over those things again, make sure you guys understand the difference between each of those. And then of course, all of the different types of injuries that we can have. There's usually a lot of C-spine stuff on there. Okay, so just kind of remember that. Abdominal stuff, that's the other thing I always suggest you guys cover again too, is know what sits in those quadrants, right? Go back to your book, look it up, make sure you guys kind of know what sits where, because they will tell you stuff like, you have pain to the right lower quadrant, and they'll give you some signs and symptoms, and they'll say, what could possibly be going on with this patient, right? And if it was classic pain to just right lower quadrant, what would you immediately be thinking? Appendicitis kind of stuff, okay? So just go back and look at those if you guys forgot all that stuff already, which most of us will after class is done. Okay, peds. Peds is another section that a lot of guys have a hard time with. Okay, no, they love to ask the differences between adults and pediatrics. That's kind of how the questions are worded. Like an adult they'll ask you, oh, how about I'll just ask you, does an adult have a larger or smaller tongue than our kids? Smaller. Okay, so you got to know your anatomy, the differences between the two. I've seen a lot of those kinds of questions, okay, especially airway stuff.
Well, like the tongue is.
So try unmute yourself so they can hear your question.
So
Go
like
ahead.
their like tongue is smaller to their body, yeah. Not
No, opposite.
Yeah.
So,
no,
well,
but
the
it's not.
tongue,
It's not like a baby tongue versus an adult tongue.
no,
Like, the
so,
adult tongue will be bigger, but
Proportion.
proportionally
Proportion.
to their body, it's smaller, right?
okay, try mute yourself again for a second. Okay, so just to be clear, so for peds, and this is NREMT question, the tongue is proportionally larger compared to the size of the head, right? And it's the head because they've got, or just the airway in general, right? Because they've got this, babies are itty bitty, their bodies are small, and they've got this big old tongue there, which is why when we manipulate their head, what do we need to do when we're ventilating our babies if we're doing positive pressure?
Yeah.
Okay, yeah, so we have to cushion underneath, right? And that's because of the fact that the tongue is so big in proportion to that airway into their mouth, that if we don't get them lifted a little bit better, it so easily occludes the airway, okay? All right, operations, the one we all love to neglect. Okay, that was, of course, especially because a lot of it was what chapters, like one, like the first few chapters, right? So that's always the first thing that's going to be out the door when we start studying for this test. So please go back and go over that stuff. They like to ask stuff like how you place yourself, how you place the rig, around the corner, or where you're going to situate yourself when you pull up to the accident itself. So do we put ourselves in front or behind a vehicle when we put up, right? Because we want to protect ourselves, right? We want to give ourselves a barrier. So it's someone who loves to bottleneck and isn't paying attention, and they decide to slam into the side of the road. Hopefully they hit the rig and not us. So that kind of stuff. Rescue and extrication. So that's a lot of the questions that'll say, let's say you had a car that went over the side of the cliff and we all show up and you need to call for additional resources. Who is actually responsible for those types of incidences? Fire, but particularly rescue. Okay, so the rescue guys, we would need to have that. Triage, I'm pretty sure I put triage notes in your Google Classroom. I will double check on that, but I think it's in there. That was part of my notes. So go over triage, know the acronyms for the different triage scenarios, and then just kind of understand what each color means. Hazmat, there's not a lot of stuff on hazmat, but at least you guys, I think everybody in this class has done hazmat or is taking it. So that should be okay. I think as far as for your sections that you need to study more for this class, at least hazmat, you guys have a little extra information because you guys have spent more time on it. So I wouldn't stress out too much on that stuff. I think you guys will be okay.
Just be upwind, uphill before you check you guys.
Yes, yes. So I think that'll be really, really helpful. All right, questions on that stuff. Just wanted to make sure we kind of cover that before we go on. Okay. So the first thing I'm gonna do, instead of doing that time quiz on your own, I'm gonna go through a quick 10 together so that we can kind of just look at the questions and start talking about how we rule stuff out. All those things we talked about yesterday, right? Our rule outs, reading the question properly, sticking to our time, and then making sure we look at all the answers before we actually choose it. Yes.
Sharing your screen.
Yes. Yeah, I'm gonna share mine for now. Just make sure, and if you guys have had these questions already, that's fine. I don't care if you know the answers, but it's important for us to kind of just talk about it to break it down. Okay. And then after this, you guys are gonna we're gonna do time quizzes. Okay. Which of the following is the correct procedure for initiating high flow O2 therapy via a non-rebreather mask? Let's take a look at the first one. So your option is select the correct mask size, turn on your oxygen, adjust the flow to 10 to 15 liters per minute, place the mask over the patient's face, adjust accordingly. There is no need to wait for inflation of the reservoir bag. What's already wrong with that question? We know we got to inflate the reservoir bag. So that one's out. Okay. Select B, select the correct mask size, turn on the oxygen source, adjust flow oxygen to 1 to 6 liters per minute. What is wrong with that? 1 to 6, because our flow rate is 10 to 15. Okay, so B is out. And for the most part, there's always going to be 2 that you should automatically be able to rule out if you guys know your stuff, right? 2, you'll be like, okay, I already know that's wrong. Let's not even worry about those 2. Now we can negotiate between the last 2. So C, select the correct mask size, turn on your O2 source, adjust the flow of oxygen 10 to 15 liters per minute, inflate the reservoir bag by attaching the tubing directly to the bag, run the tubing from the oxygen source to the non-rebreather mask, place the mask over the patient's face and adjust accordingly. What is wrong with that one?
The way they inflate.
Doesn't make sense.
The way that they flow. Right. So if you think about it, do we attach the tubing directly to the bag? No. Where does it go to? It goes to the actual mask. So that would, for this particular question, that's where I would tell you that you could already, the way they worded it, we know it doesn't go to the bag, it goes to the mask. So that would just leave us with D, right? Correct mask size, turn on your O2, adjust your flow 10 to 15, reservoir bag is inflated. We know we got to put our fingers over the bag to inflate it, put it over the patient, adjust. Okay, good, makes sense? Okay, which of the following occurs during the inhalation phase of a spontaneously breathing patient? So A, air pressure with, so this is one of those questions, if you don't remember all this stuff, we have to start doing some rule outs, right? So let's go through each one. Air pressure within the thorax increases. Diaphragm creates negative pressure in the thorax. Air is pushed from the lungs. The diaphragm and intercostal muscles relax. So, okay, so we're ruling out D is out. Okay, so we know it's not relaxed. What else do you think you could rule out? Okay, so C, even if you couldn't remember exactly what's happening pathophys wise, if you think about it, and this is what I want you to do when you guys are doing your airway section in that NREMT, when it's asking this kind of stuff, especially inhalation, exhalation stuff, take a breath, right? I like, honestly, it sounds funny, but when you think about it, you sit there and just go, okay, yeah, I'm not relaxed when I inhale, obviously, right? Because sometimes even the simplest questions, you just draw a blank, take a breath and think about what your body is doing. So you can go, okay, I know it's not being pushed out. Okay. So what do you guys think the answer is between the last 2? I want you guys to think, even if you had to like go, well, 50-50, at least you're 50-50 now, right? And it's, you don't have 25%, it's 50-50.
Does E happen right before?
So I will tell you that you do actually create this negative pressure, okay? Because when you inhale, you have to remember that we create this negative pressure so that the positive pressure on the outside is now gonna come in, okay, when we exhale and we relax. I'm gonna, what? I did. Sure. Did we really? Well, at least you guys are paying attention, Jesus. Oh, I can't go back. Wait, my screen is different because I have everybody on our thing. Hold on. Holy heck. Okay, now I gotta move stuff all over again. Okay. This is one of those questions I think you guys might actually not know because it's not something we don't go over a lot of the suction stuff, but let's talk about this a little bit. Okay, so which of the following is true regarding suctioning for children? Before we even look at any of this stuff, okay, and let's say you start looking at it and you're going, oh my God, I don't even know what is what. Does anybody remember why we don't suction too long? They can get hypoxic, right? And what is actually causing that patient to get hypoxic is another one of the things that happens is we cause that vagus nerve to get stimulated. Okay, and if you guys, does anybody know or remember what happens when we stimulate that vagus nerve? What happens to our blood vessels? Do they constrict or do they open? Well, that's wrong. So what's the other answer? So the vagus nerve, guys, that's the one like when you let's say if you push too hard when you're going to the bathroom, right? Or somebody comes around this corner and scares the crap out of you, you take this deep breath and you bear down. Okay, that stimulates the vagus nerve, blood vessels start to dilate, blood pressure dumps, we can get hypoxic, and suctioning too much can actually cause that vagus nerve to get stimulated. So the rest of this stuff, I know you guys didn't cover a lot of it, but that's what can happen across the board with suctioning. Okay, as we can stimulate the vagus nerve and cause our patient to get more hypoxic. So do you guys know what that Yankar tip is for suctioning? The Yankar tip is, it's actually it's a rigid one. So, you know, a lot of our suctioning things, we have those soft tip catheters. The Yankar tip is the rigid one. So you actually wouldn't be sticking a rigid tip into someone's nose. The what? No. What's, oh no, it's, yes, it's like what the dentists use. That's a good way of thinking about it. It's that thing that they stick in there and they, did you have a question, Chara? No, because how far in, when we suction, how far in do we go? Only as far as you can see. And you guys should remember that because that was skills testing, right?
There's a lot of it that are just like the measured length.
Yes, yes. But you don't ever, because think about this. If you guys were to go in until you hit resistance, think about it this way. When you take an OPA and someone has a gag reflex and we go ahead and stick something in there until we actually hit resistance, what's going to happen? What? A patient's going to vomit. Okay, so think about it that way. We don't want to hit anything because if they have a gag reflex, we're going to cause them to vomit and now you're going to have a lot more stuff to suction out. Okay. All right. That so that French whistle tip is actually used for stomas.
Oh.
That's what that's for. Okay. Which of the following is the appropriate step if the stomach appears to be distending during assisted ventilation? Assisted ventilation means we're doing what? BVM. Okay. So A, recheck and reposition the patient's head, watching for the rise and fall of the chest wall. B, press firmly on the patient's abdomen. C, suction during withdrawal for no more than 10 seconds. And D, discontinue ventilation for 2 minutes. You going B?
I chose B.
Okay, that's wrong. Okay, so here's the thing with pressing on the patient's abdomen. Anything in that stomach that's sitting there and we push, where are those contents going to go? Up, which means it's going to end up where? In the patient's airway, all over you. It can just cause a lot of problems. So that's a technique we actually used to do and we still sometimes can do, but that's not something we practice regularly. Yes, Alejandro, how can I help you?
There was a procedure where so that you do.
Yes. So so that is in your OB. So don't let that confuse you. But we'll get to that with OB. That's when we're trying to help. That's we're pushing on the belly to help get that baby out. Okay. So just remember that if a patient has a distended belly, think about if someone were to press on your belly and you had a bunch of stuff in there, you know, you're going to vomit. That stuff is going to come out. So that's not ideal for us to do. Okay. So it's going to be to reposition the head, and we're always going to want to watch for rise and fall of the chest. So that makes the most sense. We would rule out suction during withdrawal for no more than 10 seconds because it is not telling us that there's stuff in the airway. It's not talking about, it's not talking anything about suctioning, right? So that would be us adding information in that's not there. Okay. Discontinue ventilation for 2 minutes. Do we ever do that? So that one too would be automatically out. Okay, good, guys. Which of the following are results of hypoventilation? So this is another one of those things when you guys are taking your NREMT and you start seeing hypercarbia, hypocarbia, hyper this, and it gets really, really confusing. Okay. Let's say you had no idea what a lot of these meant. So even though it says on here, select the 3 answer options that are correct, you're not going to have anything like that on NREMT. Okay, this is just checking knowledge. They're not going to tell you select 3 answers. Everything is going to be a 1 selection. Pocket Prep does this because you guys do need to know what those are, and they'll probably tell you what is the one thing that is not correct. Okay, that would be the way they would word it. So hypoventilation, what does that word mean? Low ventilation. Okay, so a slow respiratory rate. When we breathe slowly, what are we supposed to be breathing out? We're getting rid, so we're supposed to be getting rid of carbon dioxide when we exhale, right? So if our exhalation is very, very low, or it's at a low rate, I should say, we start retaining or keeping that CO2, right? It stays in our body now because we're not blowing it off at the rate that we're supposed to. So if you think about it that way, that exhalation allows us to blow off CO2. Now we're not exhaling at a good enough rate. So we're starting to keep that CO2 in there, which means our CO2 level goes up or down. It goes up, okay? So up means what? Hypercarbia. Okay. So the only other option there that is the opposite of that is hypocarbia. So that is going to, if you didn't know what the rest of them meant, hypocarbia is out. If you're confident that hypercarbia is, what we're dealing with, then we know the opposite one is out, right? So that would leave us with minute volume reduction. And of course, minute volume, what does that mean? Okay, good. And then does anybody know what atelectasis is? So that's when your alveoli start to collapse. That's what that is. And if you're not breathing out enough, right, or your minute volume is down and your respiratory rate isn't what it's supposed to be, that's what can actually happen to the alveoli. They can start to collapse. Okay, so even if you didn't know what that meant, if you can understand that pathophys, that you're not breathing out enough, so CO2 is staying in, we know we're going to get hypercarbic, too much carbon dioxide, we can rule out hypo. Make sense? Okay. Which of the following options best explains, what's our keyword? Best. Best explains the process of inhalation. Let's take a look. Diaphragm and intercostal muscles contract, increasing the size of the thoracic cavity and creating a negative pressure, which pulls air into the lungs. The diaphragm and intercostal muscles relax, increasing the size of the thoracic cavity and pulling air into the lungs. Diaphragm and intercostal muscles contract, decreasing the size of the thoracic cavity and pulling air into the lungs. Or the diaphragm contracts while the intercostal muscles relax, decreasing the size of the lungs and pushing air into the bloodstream. Which one sounds completely wrong to you? Okay. Okay. So let's look at A. The diaphragm and intercostal muscles contract, increasing the size of the thoracic cavity. So take a breath, right? What happens to your thoracic cavity? Does it get bigger or smaller?
It gets smaller to your diaphragm.
Okay. And creates a negative pressure, which pulls air into the lungs. Or what do we have? C, the diaphragm and intercostal muscles contract, decreasing the size of thoracic cavity and pulling air into the lungs. So which one do you think you'd go with? What you guys guessing?
I know it's A. It's always better.
We're betting. Okay. Alright. Alright. We're gonna wait till we get to the, I want to get through this. Okay, which of the following, this one, who is familiar with King LT Airway? Should probably be nobody, because we don't, okay,
Okay, A, C, and D.
Ah, shit, what did he?
A, C, and D, that's your guess?
Yeah.
Okay, so this is one of those questions you would probably just have to guess, right? But I'll tell you that the white is actually the wrong size.
What? They red?
Oh, no.
Is it red? It's red.
No.
So you have to pick the three that are correct.
Oh.
Okay, but white, I think is a size 1.
Yeah.
Yeah.
Oh.
But so the King LT Airway is something that is commonly used. We are supposed to be getting those, and it's supposed to be more efficient for an airway, and it's almost looks like an OPA, but it has some extra stuff on there. It's kind of like a
Yeah.
smaller version of our ET tube. You guys know-
Color coordinated by size.
Yeah, and you guys know how, our ET tubes, our intubation tubes that the medics use to intubate our patients. It has those little balloon on there that occludes the airway. That's what the King LTs do, but they're a much smaller version. And so they're made like that so that even in an EMT or like if a fireman was there, you could easily just take it. It's inserted like an OPA and it goes right in. But of course, here in Hawaii with our city and county and our lack of money, we haven't gotten our,
Is that the one that
Our-
we first learned about? No. Putting them off and then like.
that's your,
That's the.
wait, what are you thinking about? Your combi, oh, your combi tube. That's what you're thinking about, combi tube. And it's kind of the same theory with the combi tube as well. Okay, but that's what the King LT is. This is one of those questions though, if you do your pocket prep, it's easier for you guys to figure out, at least something like this would come up and you'll be like, oh, I wouldn't have known that, but I remember seeing it in pocket prep. Okay, and that's what people have told me. The more time they've spent, it's like 1 or 2 questions that they said, oh, I had no idea, but I remembered reading it in pocket prep or crash course.
What's the size 2 for LCs?
What is the what?
Size 2.
I don't even remember. Like I said, we don't really use these, so I don't know all the sizes. I do remember that white is a 1, but yeah. Okay. So why are children more susceptible to airway obstruction than adults? We just talked about this one. So hopefully, what do we think our answer is here? Very good.
Yeah.
And that's the exact kind of question we're talking about. Okay. How about this little bad boy here? This, you would have to know your anatomy.
Okay, no.
2.
2 of the consensus, 2 is correct. Okay. 3 on the right. Very good. Right. So that's okay. But this is why I tell you guys, this is one of those things, like if you had a little airway thing that you just put up at home so that you can look at it, it's going to help you remember this kind of stuff. Right.
On the left, because the heart is on.
Yeah.
Yeah, on the right.
Which of the following are indications for CPAP? Tell me what is wrong with the very first answer. Well, it doesn't say that. What does apnea mean? They're not breathing, right? What do you have to be able to do if we're going to use CPAP? You have to be breathing. Done. Right? A is out. You can go ahead and look. I mean, I still want you to look at the rest and be like, yep. Okay, we know we can use it for the next 3, but we know you have to be breathing and be able to hold your own airway in order for us to use CPAP. CPAP works with the patient's respirations. Okay, that's how it works. So when that air is getting forced in, the patient is assisting to take that air in. And if they don't have an open airway and they're not breathing on their own, CPAP is not going to work. Okay. Yes.
Just for
Oh, you're good. You're good. Go ahead.
wording purposes,
Did you
would-
unmute yourself? No.
I did,
Okay.
would breathing and not being able to maintain your own airway mean the same thing?
Well, a patient can be, well, yes, I guess, yes, without having to go into the whole thing about it, yes. Okay, you have to be able to hold your own airway. So if they use the term not breathing, or if they use anything to do with apnea, right, it's just, you're not breathing on your own. We're not gonna use something like that. So in this, if you can't use CPAP, patient's apnea, that's our skill. What do we use? BVM,
Question.
right? Yes.
Why would you not use a CPAP if the patient has hypotension?
If they have what?
Hypotension.
If they have hypotension, because, okay, that's a pathophys thing that I'm not gonna spend a lot of time on, but the issue is it is very taxing on a patient. Okay, so sometimes, and that's not gonna be across the board. It just depends on the status of the patient and what we actually need to do for them, but we can actually make their pressure go down even more. And that's with a lot of the stuff that we do, right? If they already have a low blood pressure, we really have to kind of take into consideration the techniques we're going to use, what we're going to treat the patient with, and are they at a point to where if we do something, we're going to drop that blood pressure even more, right? Because that's a problem. We bottom somebody out who's already hypotensive, what's going to happen to our patient? What are we going to be doing next? 1 and 2 and 3 and 4 and 5, we're gonna start doing CPR. Okay, we don't want to be the person who puts our patient into cardiac arrest. Okay, that means we suck. You're gonna what?
Wow, I wouldn't even think of all.
You what? You're
He's like, nah.
okay.
Well, that's good.
Oh crap. What are you doing? Oh shoot, sorry. I always do that. Okay.
Oh my.
What? Oh God, look, see, I would have. I'm just making sure you guys are paying attention. Oh my God, unless we hit something else wrong. Look at that. Okay. All right, everybody. Take a deep breath. That was a lot of information. We are going to go to pull up your pocket preps. See, I don't even know what time is it? 10:18. Okay, good. Time quiz. I want everybody to go to 10 minutes, and then we're going to change our settings a little bit. I'm going to show you, Sabbath. You paying attention? Okay. Quiz settings right here. Click on that, and I want you to click airway, respiration, ventilation, and cardiology. Okay. For our time quiz. So we're gonna do a 10-minute time quiz. Now we're gonna include both sections, cardiology and airway. Then we can make sure your show answers at the end is checked. Close that out. Everybody take a second to take your breath before we do our little timed quiz. I want you to relax. I don't want to hear you guys swearing at your computer because you're pissed off at your time quiz. This is your practice time. This is your study time. Okay, so
Can I
this
do
is
a
where-
minute of focusing?
This is the time to get it wrong, right? Then you go back tonight when you guys go home, and once we get through all these quizzes, when you guys go over your stuff tonight, go back and look at your quizzes because it'll be listed on there, the quizzes you did. Go over, and I also suggest this setting here. The one on the bottom, I gotta move this. The one on the bottom that has the missed questions, I suggest going over that. Okay, because a lot of the stuff they ask are the things that you guys need to know. So go over your missed questions, if anything, and just see why you got them wrong. Okay,
Can I do a quick 1 minute focus?
ready?
Miley?
Oh, sorry. So back to our 10
Miley,
minutes.
Miley,
I'm just
can
gonna
you hear
start
me,
it at
Mai?
the same time so I can keep track of your time.
can you hear me? Can you guys hear me?
Oh, shoots. Sorry.
Can I hear me? That's the first time that someone can't hear me because my voice is so loud. Can we do a 1 minute focus? Breathing focus? Okay.
Yep.
Okay, everybody.
Focus.
Sit up straight in your chair. Shrug your shoulders back. Open your chest. Close your eyes. Don't talk. Okay, just focus in a moment. Get a clear picture in your mind of your goal for this quiz. Get a picture of the percentage that you want to reach in this practice quiz. If it's 100, if it's 90, whatever you think you can do. Get a clear picture of that in your head right now. Chant that mantra in your head. 100%, 100%, 100%. Okay, hold that picture in your mind. Deep breath in. Hold it. Exhale. One more breath. Deep breath in. Hold it. Focus yourself. Exhale. One more time. Get that clear picture in your head. Deep breath in. Hold it. Big exhale. Okay, keeping your eyes closed. Just shrug your shoulders. Get ready. Okay, open your eyes and let's go.
100%, guys. Ready, set, start quiz. You got this. Okay, submit it. How'd you guys do? Thumbs down. Ah, don't say that. Don't say I feel stupider. Why you gotta be negative? Sabit,
I got a lot of, suck.
every time you swear, I'm gonna pull your ear.
Oh, they're asking for the freaking, Oh, that's. Elite.
Yeah.
I was like, I know.
So we're gonna talk about that. That is not something we really, again, like that was kind of what Alejandro asked the other day. So that's just not something we spend a lot of time on because you guys aren't required to do 12 leads. What was that question?
It said, which of the following is the correct placement of the lead free electrode obtaining this quality? ECG?
You know what I'll do is I will get you guys, I think, and I'll put it in the,
Obvious, it seemed too obvious because it says between B2 and B4 and I was like.
Okay.
do I have to take the-
okay, so then that should, no, so that is actually good. I'm glad the question was worded that way because just so you guys understand, when we do the 12 lead, and I don't know if did everybody get to see, boys, are we listening?
Yes.
Did everybody get to see a 12 lead done when you guys were writing or not really? No.
Yeah.
Okay, so basically when we do our normal EKG, right, how many electrode placements do we have? 4, right? And then what the V leads do is we actually line them along, it's basically just going along your heart, right? So we go 1, 2, 3, 4, 5, 6. And so we do like this little kind of half moon shape with all the V leads, but they're all in order. And they shouldn't really be asking you more than that because you guys aren't required to know what those do. But all it is what the V leads tell us is they look at the heart from all these different angles so that when we actually read the EKG and we look at what the heart is doing, we can tell exactly where the infarct or when they're having that myocardial infarction, we can actually see exactly where it is. If it's on the right side, if it's an anterior, inferior. So it's kind of really neat because once we line those things up and you'll see the line start changing and we can see exactly where the problem is. So that's what they're for. But you guys won't need to know more than that, other than we place them in order that way. Okay. Yes, comma.
We had another question, which of the following are both established by AHA for the management of a systemic
STEMI. Okay. 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 So that kind of stuff, don't worry too much about the more advanced ones. You guys may get one of those, but you really shouldn't be getting that. Does anybody remember, I did talk about it briefly, but does anybody remember what a STEMI is? The question, what I think everybody's trying to figure out, for those of you who can't hear. Very good. So a STEMI, if you guys see that word in your quizzes, it is a ST elevation MI. And you guys remember when, I just want this real quick because I do want you guys to kind of remember this. Everybody can see my little whiteboard there, right? Okay. So if you guys remember what a normal EKG looks like, right? It's our P wave and then we get the QRS, right? And then it comes back this way and then we have that little T wave and then it keeps going, right? ST elevation MI, what happens is because this is the P, this is our QRS complex and this is the T. So what happens here is this T wave, instead of going down and coming like that, our EKG basically does this. And we can still, the T wave will come back up here. And actually make it look a little better, sorry. So our QRS wave doesn't come all the way down here the way it's supposed to. It'll kind of stop here. And then you'll see this elevated T wave here. So we don't see this line come down. And this is what an ST elevation MI means, is that this ST segment, the S part of the S wave and the T wave get elevated. And so if our baseline is here, we can see that there's this big space here that this should be down here. Okay, so if it does that, it's a specific type of heart attack that they're having. What is what? Percutaneous. So that's when they go in and they do the balloon therapy.
Oh, okay.
So you can go, where you go, you get the stent, you can go into the veins and you can go and open things up. So the fibrinolytic therapy, do you guys, so Clot busters, very good.
So.
What is that?
Breaks clot.
No, everybody should have kind of different stuff, but it's good to, you know,
It fishes it out.
okay.
It breaks it. It breaks it.
So-
What's the word? It fishes the clot out. You can do that?
That's kind of like the percutaneous, when it goes in, they can actually
What's
go
the
in and
name
get
of
it
the
out.
treatment,
I don't know exactly what it's called when they take it out instead of basically just opening up, but it is that percutaneous therapy to where they go in and remove the clot. Okay.
What is
Anything for family.
NCO2?
Okay, so that is the question is, what is the PET CO2? Does anybody remember what that is?
CO2.
When you're, is it, did you have the Ross one?
You can try unmute yourself, so they can hear you, Jara.
Wait, Erin, did you have the Ross question?
Yes.
Yeah, okay, so.
Does anybody know what that is? Anybody else who's not here as well? I'm not, you guys get out of talking. I'm gonna start calling on you guys. I'm gonna wake everybody up. So, you know how we tell you we have these pieces of equipment. Oh, sorry, am I muted? Yep, nope. So we have pieces of equipment that can monitor the CO2 levels, and that's what it is. It's that we can actually hook on a piece of equipment. It monitors the CO2 so that when we're bagging somebody, right, it can actually, especially for someone who's in cardiac arrest, if I notice that we start having CO2 levels, that means that the patient is actually starting to breathe on their own, because now they're breathing out that CO2. So that's what that is referring to.
So it was that I.
Yes.
Three things.
Okay. We're gonna do one last, I think, no, Kama went to the bathroom. Does anybody else who's not here, I know my kids in here are like, we're perfect, got a teacher in here, ask lots of questions. Does anybody who's not here have any questions right now? Are you guys okay? Okay, so what we're gonna do is we're gonna do one last timed quiz. 10:40. Okay, here's what I want you guys to do. Let's finish with a 15-minute. Okay, let's finish with a 15-minute, because that's gonna put us to the end of class. But I think we need to I want to increase stuff a little bit just to give you guys a little more study time in class. Oh, John just walked in the door. Okay, so go to its time quiz again, guys. Put it at 15. Let's finish with a 15-minute. I think you guys can do it. And then just so you guys know, for the last day of class, we're gonna do a mock exam. So we're doing the full, that is your whole last class though. It's 120 questions. You're gonna have the full class to do it. And it's what? Why are you raising your
Miley,
hand? You're missing
Miley,
Tuesday is
isn't
your
it-
last class.
Miley, isn't it
Thank you.
Miley?
Promise that they're gonna take their quiz.
Is it
Yes.
Miley? Miley,
So yeah, so just same settings, keep it on airway and cardiology. Go to your time quiz, put it to 15 minutes.
By the way, we
Yep.
just keep going, I was like, I answered like 10 questions, I was like, okay, I'm done. Then I was like.
Stop it.
I remember, I was like, okay. what's the point?
See, someone does not follow directions, and of course, it's someone from my class. I take full responsibility for that.
Then I answered like 11 responses after that.
It's a time.
There's always got to be one special one that can't follow directions.
But then I did it, but
How is doing 10 questions and stopping gonna help you?
11 more
Oh my God,
questions.
I cannot.
Don't worry.
Okay. Are we ready? Kalehua, did you wanna do anything, or should we have them just take a breath on their own?
they can take a breath when they're
Take a breath.
ready, but Miley, can you hear me?
Sorry?
Miley, can you hear me?
Is she, I don't.
Why can't you hear me? Can everybody else hear me?
Okay,
Miley,
okay,
Miley,
yeah, cardiology and airway, both. Okay, everybody ready? Okay, go ahead. Take a deep breath real quick. Start your
can you hear
quiz.
me? How come Miley can't hear me?
Right. All right, everybody can submit their quizzes, see how you guys did. How's everybody feeling? So, okay. Couple things before we go today. Guys, please make sure you're checking your Google Classroom, okay? Kalihua and I put a lot of time into putting this class together for you, and the things that we put on there and the things that we ask you guys to do are for a good reason, okay? JK is gonna come show his face too. He's gonna give you guys stink eye. Okay, but it's for your benefit. It is, if you guys aren't doing everything that we're giving you to help you get through this, then you're not doing yourself any justice. Okay, and we really, really want to see you guys succeed, and please take advantage of everything that we've set up for you and all of these options that we're giving you to use. Couple of changes. I think that the Kalihua kind of reminded me last time we did this class, we did the actual mock exam the day before we finished. But I think that because we have 3 sections left still, I think it's more beneficial for you guys to be able to go home and spend each day concentrating on that one subject, whether we're, our cardiology, our airway, all that good stuff. So we'll just do it on the last day. Then we can just look at your results right away and we can have a quick chat about it. And then we can kind of help you guys go, okay, this is what you need to take away from your results. This is where you need to make sure you make adjustments and do a little bit more practice. Okay. Kalihua, do you want to pull up the homework stuff for today? Thank you.
Can you see it?
Yep.
Okay, so me first. Okay, so practice your relaxation, visualization, deep breathing exercise that we've been doing before you take your quiz. That'll help you visualize your goals. Try out the Pomodoro technique when you're studying for your quizzes. That's all on my side.
Okay, so for you guys got cardiology tonight. Okay, I do suggest doing, so those 100 questions, I suggest focusing on just the cardiology. And then when you do your next time quiz, do the 2 sections that we're into now. So do airway and cardiology for the 70 questions. Okay, but that's the best way for you guys to kind of make sure you're covering a little bit more of each subject every day. Okay, so 100 cardiology, and then the 70 is going to be cardiology and airway. And then that's it. Do your crash course book. The more questions you guys do, the more beneficial for you, right? And for those of you who are sitting here going, I feel stupid because I heard that, and you're frustrated and you think you did better than you actually did, the more you practice, the better it's going to get, right? Go over those missed questions, figure out why it is that you're getting those things wrong. That's the best way you can help yourself, right? We told you cramming is not going to help you at this point. If you didn't do your work throughout the semester, not much you can do about it now, other than put in as much time as you can and utilize these study guides to help you do better. Okay. Any other questions for today? No? All right. You guys are free to go. And we will see you tomorrow morning.
Thank you.
Thank you, Ms.
Thank you,
K.
everybody.
Thank
Thank
you.
you. Take care. See you tomorrow morning.
Thank you.
Okay, Miley, I see you tomorrow. I see you tomorrow. What was I gonna tell? Oh, wait, let me the recording.